Good evening from Ghana. I've been here about 10 days now. I'm a nurse and that's the main reason why I've come here. I'm based at the Pope John Paul II Medical Centre in Jamasi, which is like a community hospital. There's lots of outpatient departments, a small A&E antenatal clinics as well. I've been working with the mental health team. I'm accountable to Dr. Berko, who's the medical director, and the mental health team are not as busy as they could be, which is a shame because the rest of the hospital is really busy, particularly in the morning. A lot of the patients arrive in the morning even though their appointment's not till the afternoon, and I think that's a transport thing. So in the morning I go in at 8 and you can't get a seat in any of the waiting areas. The antenatal clinic, the outpatient areas they've all got patients already sitting. The waiting area for A&E is always absolutely heaving as well. So it's really busy, it's really hot. There's ceiling fans and the windows and doors are all open, but it's stuffy because it's 30 degrees here and that's the temperature it seems to be all year round. There's air conditioning units in the consulting room, so they're quite cool for patients. As I say, the mental health team that I'm working with are not as busy, and they see the more severe cases. So they see like psychotic illness, schizophrenia, mania. They see some severe addictions, but they wouldn't see something like mild depression, anxiety. They don't do a lot of counselling. Most of the treatment is medication based, and that seems to be, what the protocols are here. I'm accountable to Dr. Berko, and he knows that the mental health team are not busy, and I spoke to him about just some proposals and ideas as to what we could do to improve that, to try and make the mental health team more viable, because if it was in the UK just now, they would shut it down because there aren't enough patients. I think they need to do more professional to professional referrals, so from within maybe the hospital to the mental health team, maybe someone that's struggling, and also self-referrals, how we can get more patients to refer themselves, because I think it's the stigma. They're just sort of trapped with patients, families who don't believe they've got a disorder, who would rather try traditional medicine than Western medicine as they see it. I was with the mental health team yesterday, and we do have some downtime, and we were sitting chatting. So there was about 8 of us in this room, and all of a sudden at the door this woman appeared in a very crisp white uniform, because we were all we're in professional dress, but we weren't dressed in uniform. So she appeared, and she stood, and everybody looked at her and they all stood to their feet to attention, and the atmosphere completely changed from being pretty relaxed to being very formal. And I sort of got to my feet slowly, and I said, I suppose I'd better stand up, sorry, and I introduced myself to her. And she's the nurse manager, so like the matron for the whole hospital. So I'm accountable to her as well as Dr. Berko. And it was just really odd. I haven't stood up for like a matron or a nursing officer since like the late 80s. It just seemed, the hierarchy is obviously very entrenched here. And you should respect your superiors for their skills and knowledge. I get that, but it was just quite odd. So that was something I've learned. I'll remember her, and I'll remember the next time to stand up. I'm trying hard here with the team to try and generate more business, and if anybody has done anything like that anywhere, please feel free to email me. It's faye.carruthersthompson@gmail.com, and I'll put that in the description as well. I'm comfortable getting emails from people because I want to improve patient care. I want the mental health team to be more viable. I want to make a bit of a mark while I'm here. I don't need to leave a legacy, but even if I can improve one thing for one person, then I'll feel that that I've done something. And that's really what any clinician wants. You're just trying to chip away and make slow improvements. So please get in touch if you wish, and I'll let you know how things go over the next week or so.